Well, good afternoon, and I want to thank the Society and our co-moderators for having me on the panel today. I was asked to talk about the fundamentals of endoscopic surgery program, particularly in relationship to virtual reality. And so that's what we'll spend our time on. I have no relevant disclosures for this talk, and I'd like to spend our time reviewing these objectives. So I want to give you a brief overview of the fundamentals of endoscopic surgery, an insight into the design process for the hands-on skills component of that test, talk about some of the validity evidence around it, and then give you a glimpse at how FES is being used in the present and how it's going to be used in the future. So first of all, what is the fundamentals of endoscopic surgery? It's a common question I get in today's day and age when we're talking about curricula. It's often confused. And my answer to this is it's a test. It's a test of knowledge and skill in flexible GI endoscopy. And it's modeled after the fundamentals of laparoscopic surgery program. And just to review that program, FLS is also a test of knowledge and skill in laparoscopy that really has three components to it. It has this didactic component, which is this web-enabled content that is to help you get the knowledge required to understand the basics of laparoscopy. There's a written exam that you take on a computer, and then there's a hands-on skills test. And all of this has validity evidence around it that is of high quality and allows it to reach a level of a high-stakes exam. FES is arranged exactly the same way. So there's an online didactic component that is all things that we think somebody should know about the fundamentals of endoscopy. There's a written exam, and there's a hands-on skills test, with one of the major differences being that that skills test is done on a virtual reality simulator. The history of FES actually dates back to 2005, so this is not a program that just developed within a few months and kind of as a flight of ideas. It came out of the report of the success of the FLS program at the SAGES board, and one of our past presidents, Bruce Shermer, commented that, hey, wouldn't it be great to have a fundamentals of endoscopic surgery to promote what the society was trying to work on in the flexible endoscopy domain. This was kind of seconded by two other past presidents of SAGES, Jeff Ponsky and Nat Soper, and they actually turned to Jeff Marks, who was the chair of the flexible endoscopy committee of SAGES at the time, to try to make this happen. Jeff, being an astute person for recruiting, recruited his former fellow, that was me, to help with the project, and the FES task force was born. Now, one of the things that I tell people about FES, and I've learned a lot about this along the journey, is that the FES skills platform was not designed backwards. What do I mean by that? To me, many commercial simulators have been designed backwards. A bunch of smart people get together, they put together a program that looks very realistic in that group's mind's eye. They then develop that into a platform and deliver it to the clinician and say, tell me how this can help you be better in what you do. When the process should be kind of the opposite of that, and that was what was done for FES. So the development of the virtual reality platform for FES started with deconstructing flexible endoscopy. Let's talk about what are the essential elements, technical elements for doing this procedure well. We then went out into the world and evaluated available simulation platforms to see if they contain those elements that we needed. We designed modules and metrics to measure performance on those elements, determined who's going to pass this thing, who is the minimally qualified candidate, and determined that a priori, and then we went to testing and establishing the validity evidence around it. And so to walk through that journey a bit, this was our initial timeline for FES, and we began with a skills retreat in July of 2006. And this is a picture of Jeff Marks here, Melina Vasiliou, Lisa Yukolevics, and me. Dr. Freed, our current president, is taking the picture, so this is in his office in Montreal, trying to envision a simulator that would encompass those deconstructed skill sets that we had determined about flexible endoscopy. And this was the deconstructed set. So if you do upper or lower endoscopy, this is essentially what you do. You navigate with the scope, you reduce loops, retroflexion, etc. Those are the essential elements of doing flexible endoscopy. And we had envisioned trying to develop a low-cost simulator, very much like the FLS box, the Mistel's box, because we wanted to be able to get wide distribution. And this is the famous Jeff Marks muffin simulator, trying to display our concept of how this would work. We then went out into the world and reviewed simulation platforms out there, both virtual reality and non-virtual reality, to see if there was anything essentially off the shelf that we could use for the FES platform. And that happened at DDW in 2007. And what we came to find was that there was really no acceptable platform out there, either in the virtual reality or in the non-virtual reality environment. And we were going to be left to create this essentially de novo. And so if we were going to do this de novo, we had to make a decision about using a virtual reality platform or not. And we've heard that there are significant advantages in the VR environment. It gives us a predictable and reproducible testing conditions, accurate and objective metrics that are automatically recorded. It doesn't require a full endoscopic platform, and it's easy to record and report the results. And we liked those features. We wanted to take the trained proctor or the expert proctor out of the equation. So we decided to embark on a virtual reality platform for the FES program, and we put a request for proposals out on companies that could partner with us to develop this VR environment. Symbionics was one of the companies that responded to that RFP, and through a process was elected to be our partner as a simulation company to do this. And it was decided to develop the FES platform on the GI Mentor 2 environment, which was the latest version of the Symbionics flexible endoscopy simulator at the time. The modules that we developed were nothing that were off the shelf from Symbionics at that time. These are specific modules that were meant to address that deconstructed task list. And so the 5 elements that we recreated in the virtual environment were these: navigation, retroflexion, loop reduction, mucosal inspection, and targeting, which, if you've been paying attention, is not the entire group of the deconstructed task list, but certainly is the majority of it. We then went through an iterative process to not only develop these skills modules, but then to test their performance. And we did multiple rounds, actually, of multicenter testing. One of the more difficult modules, for example, was loop reduction, getting that to perform in a way that was required. And actually, in the first round of multicenter testing, that module did not perform at an acceptable level, had to be redesigned, and then we went out to, again, do a multicenter test to confirm the science. Different formulas were trialed to ensure that we were collecting the appropriate metrics, and all of these elements, all of these modules, I should say, have elements of proficiency and, of precision and efficiency built into them. So testing was conducted. Once we had this virtual reality platform, we had the metrics, and we decided who the minimally qualified candidates should be to pass the FES hands-on skills exam. Then we did our multi-center testing. That was conducted from February 2010 to September of 2012. We had 11 centers in North America participating in the testing, 160 test subjects total, and we had 111 with usable data sets. This is the demographics that broke out, so you can see not only did we have surgery residents, but we had fellows, we had gastroenterology fellows, and practicing attendings. The results were quite good after the second round of iterative development. So good internal consistency, retest reliability, even correlation with clinical experience. And from this data, we were able to generate cut scores, essentially the pass-fail score, that would ensure a true pass rate of 80%. If you want to review the details of this validity evidence, this article was published in the last couple of months in the Journal of our society here, with Dr. Vassiliou being the lead author. So with that as a background, where is FES today? Well, as many of you know, this society was built kind of around this conflict, the conflict between gastroenterologists and surgeons and understanding who should be doing flexible endoscopy. And in 2011, this conflict came to a bit of a head. There was a white paper published by these 4 medical societies really questioning the American Board of Surgery requirement for general surgery resident experience in flexible endoscopy, and even questioning whether or not gastroenterologists should be required to participate in that experience. The board responded to that, and as you can imagine, there was some back and forth about this. But to the board's credit, I think it really caused them to do some introspection and say, what is it that we're doing with flexible endoscopy, and should we even require this in the training of our general surgery residents? Well, as part of that introspection, the board recognized that colonoscopy is one of the top procedures that general surgeons do. And particularly if you're not in an urban environment, it can be the #1 procedure you do. So this is what the board has said, and this is my paraphrasing, by the way. So they're not going to abandon endoscopy. In fact, we're going to embrace it because it's what our constituency does, and it's what they need to do. But what we need to do is define a validated curriculum that will withstand scrutiny. And in order to do that, they wanted a multi-society effort to develop a flexible endoscopy curriculum. And they actually turned to SAGES to help promote that effort. And so through that effort, those 5 societies, SAGES, SSAT, ASCRS, ASMBS, and ASGE, got together to craft a curriculum in flexible endoscopy for general surgery residents. And the last thing I will say is the board wanted to promote surgeons, training surgeons to do flexible endoscopy. As many of you know, the flexible endoscopy curriculum from the American Board of Surgery is now reality. So last month, the board announced that, see if I can go back here, the board released the American Board of Surgery flexible endoscopy curriculum. And it is now a requirement, actually, for our general surgery residents. It's backdated a bit, so general surgery residents entering into training as of July of 2013 are required to navigate this curriculum in order to be able to sit for their board exams when they finish their training. It's a 5-year distributed curriculum. It has valid measures of knowledge and skill within it, and it qualifies a surgeon to be what we call a basic surgical endoscopist. What does that mean? These are the 5 things that a general surgery resident should be able to do when they navigate the curriculum successfully. They should be able to safely perform upper and lower endoscopy, perform mucosal inspection with accurate recognition of pathology, acquire tissue either through biopsy or polypectomy, manage periprocedural bleeding, and place a percutaneous endoscopic gastrostomy tube. As I said last month, this was on the front page of the American Board of Surgery, the announcement about this requirement for the flexible endoscopy curriculum. You can go to the board's website and download this curriculum as a PDF document, and it's linked to things like SCORE and to the didactic portion of the fundamentals of endoscopic surgery. In fact, in an effort to promote this curriculum and to improve training in flexible endoscopy, SAGES decided to make the didactic portion of FES free to the world. And so if you go to that website, www.fundamentalsdidactics.com, you can get free access to the didactic portion of the FES program. All you need to do is sign up and register. So what's the future of FES? Where are we going with this program? Well, first of all, there's an effort to get this into a form factor that is more portable and distributable. And so Symbionics has developed what's called the GI Mentor Express. You can see this is a smaller form factor than the GI Mentor 2. And we've now gone through doing the validation on this platform to ensure that it performs at an acceptable level and similar to the GI Mentor 2. Data about that study is being presented in the plenary session at this meeting. We also want to prepare people for the FES exam. One of the differences between FLS and FES is that you cannot rehearse the FES skills tasks before taking the exam. And in the discussion, we can talk a little bit about why that is. So to prepare for the exam, you need to do that on in a different way. SAGES has, as of this meeting, granted 2 grants. They put out a request for proposals for training curricula, one in a VR environment and one in a physical environment, that would show that if you navigated those curricula, you could successfully pass the skills portion of FES. And so that work is ongoing. There's also data being presented at this meeting correlating clinical performance to performance on the FES skills exam. So if you're in an environment where maybe you don't have access to simulation, you can get an understanding of what type of clinical experience is required in order to prepare you for the FES test. We also need more test centers. We have 15 approved now, 5 more are in process, and this is a distribution of those test centers across the US. You can see we need to match better the FES test centers to the density of trainees throughout the country. These test centers are being created at the same sites where FLS testing is involved. And it's envisioned that you can rehearse to prepare yourself for the FES exam on any type of platform that's relevant to the training institution that you're in, and then you would go to a test center in order to take the exam on the GI Mentor 2 simulator. So I hope that gives you a good brief overview of the FES program, an understanding of the design process for how the hands-on skills test was developed, a peek into the validity evidence. I encourage you to read both the article that describes how the how the skills test was developed. Also, there's a similar article describing how the validation work was done for the written test, and it also gives you a bit of understanding of FES present and future. Thank you very much.